Okay, let's talk about removing temporary veneers. And first thing we're going to do is evaluate our permanent veneers on your solid model, and these look fantastic. I can't wait to get these seated. I'll be using a KS2 burr on my high speed, and we're going to just slowly slice through the facials of the temps with that KS2. And you want to stop when you see the color change from the temporary to the tooth. Even though we'll start out here, it's a little damp. And the water's turned off, but eventually what we want to do is get that water and prep those dry. And so have your assistant with the suction handy, because it can get pretty dusty if you're not careful. Again, we want to go directly on the facial. Do not go interproximal. Interproximal, you can damage your margins. And notice as I'm going on these direct facials, I like to steady the handpiece with my left middle finger and just kind of hold it there and protect that gingival margin so that we don't have any possible damage. I don't want any bleeding. That would be not good. And so I just put that handpiece, I made my hand there just to prevent that from any possibility of touching the margins. You want to look for that color change from the temporary to the tooth, and that will let you know just exactly how deep you want to go. A lot of times it's a good idea to hold the model in front of you or just take a look at it just to remind yourself what the preps look like. And again, keep it dry. It's just so much easier to see what you're doing. And be aware of your lingual margins, whether it's a full crown or if it's a 3/4 crown or a veneer where there's very little lingual margin. So you know exactly where to adjust on the lingual. Just be totally aware of that. Then once you've made a little groove on each individual veneer, you'll use a crown spreader and just go into the grooves, and you're just going to make a slight little, just a little snap, if you will. Let the patient know that you might hear a little popping noise, but I'm just setting that in the groove and just kind of slowly snapping it. You don't want to put a ton of pressure on. You obviously don't want to damage the underlying tooth, but you're just separating that material, and if the groove is right through the tooth, it'll just snap right on and make it easy. Once you've made the little snap on each tooth, I like using a pair of straight hemostats. Start right between 8 and 9, wiggle back and forth a little bit, and they'll just slide right off. It couldn't be any simpler. Again, you want to squeeze interproximally though, and that takes, they'll just come off usually in pieces and 2s or 4s, and every now and then the whole thing will come off, and that's nice. You always like when that happens. But regardless, they're usually pretty simple when you do it this way. You see she's taking great care of her gums, the teeth, everything looks great, and so now we're ready for trying. Everything looks fantastic.